I'm going to give you a 2 count on the way up, and that's when you lift your... Welcome back to Kalkstein Chiropractic. We are currently working with a model of Class 4 laser that we have in the office. We're testing out to see if the model works for us in the clinic, as well as if this system is something that we want to use a little bit more. Serious diabetics, cardiovascular disease, etc. They use laser therapy for a couple of things there. Myofascial pain, musculoskeletal pain, joint pain, recovery from an injury, recovery from trauma, and then in certain cases the literature is iffy around this, but wound healing is something that laser is used in a couple different fields to help with recovery right from surgery, help with reduce infections in the wound site. And so when I got to go to Walter Reed and work there for 6 months, we had a Class 4 laser there that wasn't being utilized in the pain management clinic, and a lot of the guys coming back had some serious injuries, and working in amputee clinic, the post-surgical patients were in, as you can imagine, a lot of pain, and it was very fortunate that we had so many tools available to us to help those guys out. And so when you have a serious injury like that around the nerve, you'll get something called a neuroma, labella, and that's inflammation, scar tissue around the nerve. It's really painful. They had a couple other symptoms around the wound site itself. There was pain. They have phantom leg pain. So there's a lot of things that we're doing there. Do you need some more lotion?
No, I'm good.
How are you? How's your hand?
Getting a good workout in.
You are?
Yes.
All right. Good. You can switch it up with your left. You can balance it out with your left hand if you need to.
I did the switch a minute ago.
You're already good.
You're
pro.
mid-speech.
I'm sorry. I shouldn't bother Laser Girl while she's doing her thing. She's a pro. And so we use laser with those guys that were having that type of pain, not on the wound itself, but around the wound, to help with bringing good blood flow to the area, helping with speeding up recovery time. And they had a lot of benefit from the laser with pain reduction, to the point where we were using it quite frequently. And after I left, I think that they started working on studies with it. They were already performing studies at NIH with Class 4 laser for other areas. I think that they were doing it with PTSD or trauma to the head. So a lot of uses for laser in medical field. For myofascial pain, this type of laser, it's Class 4. That's important. There's other types of lasers out there that you might see offered. Class 4 is really important because of the length of the wavelength and the depth that it penetrates. And this type of laser will create a little bit of heat under the skin. If Morgan were to hold it there, it wouldn't feel comfortable, and if she would hold it there too long, it would burn Alex. So it's constantly being moved in this area. And very effective for pain of a lot of different spectrums. So what does it do? It's deep heat, for one. But there's also a metabolic change that happens in the tissues when you have light therapy at this range. There's an effect that the literature says that there's an effect on the mitochondria within the cell. So increase in cellular metabolism, more stuff starts to happen on a cellular level. And with good blood flow, with with more cellular metabolism happening in that area, you get an increase or decrease in healing time, so improvement in healing, and then there's also an effect on pain with the nerve as well. So there's a couple of factors that we really like this for: nerve pain, speeding up healing recovery, improving wound healing time has been shown to be beneficial as well, and yeah, it's comfortable. That's the best part about it, is that it feels good. Alex, how does it feel?
It's like a gentle warming.
Gentle, warming feeling.
Yeah.
Hey, Alex. Sorry, I didn't even say hi to you.
What's going on?
Yeah, what's going on, brother? Okay. On a side note, Alex is working his way towards a 200-miler. Morgan, you too?
Yeah, I'll be right there.
Yeah, you are? Okay.
Oh yeah.
That's pretty exciting. That's impressive stuff. And this is the type of thing that Alex uses to recover from his training, from his race. So he tweaked his hamstring. I don't even think I got into that. You tweaked your hamstring last week. He's been about 2 months pain-free in the back of the leg and the hamstring. We've been adjusting and we've been doing the strength program, and he was out on a really hot day. He wasn't feeling good during his run, and then he felt his hamstring start to tighten up on him a little bit. So we've been just taking a break from the training. And sometimes it's good to take a break, especially with the intensity of the training that he does. And we're doing more recovery work. Laser, we did dry needling before this. Laser after dry needling really helps with the soreness. It really helps with recovery rate with needling. Needling is meant to stimulate a little bit of an inflammatory response, so it's really, really effective with needle work. I love it. So I'm pushing strong for it here. And I got my laser girl on my side, ready to roll.
Ready for the next one.
The next one. Let's wear it. Ready.
Ready.
We're all ready. Alex, how'd that feel? You good?
Great, yeah. Good.
Okay, so we'll go ahead and show you how we do this and use this in different areas of the clinic going forward. If you have any questions about laser, or if you're wondering how you become a laser girl, Morgan might be able to answer those. I don't know. It's a long journey. It's a lot of hard work.
You got arm strength.
That's number 1. What's number 2? And one of these
good
attitudes.
Attitude.
That's what I'm talking
good
about.
Attitude.
So good attitude and arm strength, and you're on your way to being the next laser girl. But thanks for watching, everybody. Appreciate it.